You know that sharp nagging pain under your shoulder plate here, right here, over there, that you would just won't go away? The one that flare up when you breathe deep, or sometimes just even breathing, or twist your torso. A lot of people assume that pull muscle, but often it's actually a rib that's slightly out of alignment. I am Dr. Chen with Optimal Chiro-Rehab Center, and today we're talking about what caused that pain, what really happening inside your body, and how to treat and prevent it the right way. If you ever said, I feel like something's stuck under my shoulder plate, this one's for you. Your rib attached to your spine in the back through a small joint called the costovertebral joint. When one of those joints get irritated from poor posture, sudden movement, or even prolonged stress, the rib can slightly rotate or pop out of position, like this. If you sit like this, sit out like that, your rib attached perfectly to your spine. But when you start slouching like this, see the rib are flexible, so they have potential energy buildup. So this is your rib, this is your spine, they're attached like that. When you start slouching, your spine come forward. See, they pull the rib in, but it's like a bamboo. You pull it in, what happens? Slowly slip, right? When they slip like that, that's when the rib popped out. But it say pop out, but you might not hear anything at all. It just slowly slip. And then all of a sudden, every time you breathe, it's irritating. And the worst part is this, the longer you have that, your body try to fix it by squeezing the muscle between the two tighter. And that's why sometimes you have that knob and it's making it even worse. Think of it like a door's hinge that is just slightly off. The door still opens, but it's squeaky and dry every time. If you don't correct the underlying dysfunction, the inflammation and muscle guarding never fully go away. And the worst part is this. See, if it normal posture here is good, right? It's hurt, what happens? You slowly go like this, right? So you see, if you do that over time, see a lot of people walking like that. Because when you go back, it hurt. And imagine if you like that and go to the gym and start lifting weight, what happened? You're stuck in the poor posture. And we have patients that had that right now. Make sure you get taken care of. Every time you sit with poor posture, twist is wrong or sleep awkwardly, the joint get irritated again. Over time, the area become hypersensitive, and that's when it turns into chronic pain. The key is actually to have someone adjust that rib back, but that's not gonna fix it right away because the entire surround area is irritated and inflamed. So that's why usually if you come here, we start with acupuncture and cupping to reduce the muscle spasm, the inflammations, and then we put the muscle, the joint, the rib back where it belongs. But that's only for short term. Because if you still go back and go like that again, that joint gonna pop out again. Because when it popped out, it became loose, it keeps repeating itself over and over again. So eventually we have to strengthen muscles surrounding that area to protect it. A comprehensive treatment plan usually starts with reducing inflammations. That's where cupping and acupuncture come in. Soft tissue therapy, a little bit of massage, even laser therapy. If you're interested in learning more about acupuncture and cupping, we have a video on it. So please click the link for that. Once the surrounding tissues calm down, we can safely and effectively perform spinal and rib adjustment to restore the normal motion and alignment. But the work doesn't stop there. The adjustment helps, but the aftercare that keep it from coming back. Go to a chiropractor and just get your back cracked, just like you go to a Starbucks and just get black coffee. So most of the time what we do here is a lot more than that. We calm, we correct, we educate you, we re-coach your muscle, retrain your muscle, retrain your posture. So if you want to get a full Starbucks experience, don't just expect a crack alone. Otherwise, just drink black coffee. When alignment is restored, the focus shifts to strengthening and mobility. We use target stretches for rhomboids, serrated anterior thoracic spine, along with exercise that open up the chest and improve posture. Breathing drills also help deep control breathing to restrain the rib cage to move properly. When you combine alignment with muscle balance and flexibility, you don't just feel better, you move better. And if you come to see me directly, I don't just adjust your mid-back and neck, I actually adjust your low back as well. Because for you to have good posture, right, your spine have to move swiftly all from top to bottom. Your spine is one piece, it makes a 24 joint. So whether it's here, here, or there, they all need to move well so that you can rebuild your posture. So one of the key of fixing this, at least get less and less problem with recurrent of this is figure out what you do every day. What kind of work do you do? Let's say if you sit in a computer all day long, make sure you sit up straight. If you're slouching, sooner or later, that thing gonna pop out. Same thing if you're driving a lot, make sure your car seat is straight and with the lumbar support here. Because if you sit like this, sooner or later, that rib will pop out. If you play pickleball, you don't have good posture, you keep reaching like this, it's gonna pop out. If you're on your cell phone and don't bring it up, put your head down like this, see? As soon as I put my head down, what happened? I pull this guy, right? So sooner or later, your hand stay here, your head go here, it's gonna pop out. Almost everything we do during daily life can mess it up if we don't have good posture. Even cooking, when you're cooking, you stand, if you don't have proper posture, you kind of lean like this with the pot, right? Sooner or later, that thing will pop out. There's so many things we do nowadays in modern society that easily pop the rib out. Everybody's slightly different on how you protect yourself. But think about what you do the most every day and think how that's affect your mid-back and your arm, the position of your arm and hand, and how you can improve that. So if you can slow down and less strain on those areas, I can guarantee you, you'll be less likely to have rib out. But when you have rib out, seek somebody for help. Even when I have my rib out every now and again, I can't do it myself. I try every possible way I can think of. I have to have another doctor adjust the rib back in. And also, even when you sleep on your side, you lay like this, right? Like that. That can pop out too. When you couldn't sleep and you go back and put on your head, stay one way, your neck stay like that. That popped out too. So if you talk about the cost, there's so many costs, but it all ends up how you use your body. Most of these happen because of repetitive weaknesses. And the worst part is, let's say, most of it when you have poor posture, we have weak out trap, mid trap, and now rhomboid are weak. So your shoulder come like this, and you go and lift and weight. This muscle gets shortened. So what happens is they slowly pull sort like that. The rib get less protected. So always have to make sure, strengthen your posture so that you bring yourself on top of you. Your neck, your head is on top of your neck, so your head is on top of your shoulder, not out your chest. So even just sitting like this, open up your chest like that. A few minutes every hour actually helps strengthen your rhomboid. You don't always have to go to the gym and lift weight and all. There's many ways to do that. So if you're interested in those videos, let us know. Like I said, we've been going through a lot of things today. It's just a small amount of time, so there's many things that we might just fly through. And if you're interested in small, whatever parts that we've spoke about, please do not hesitate to give us a note on the bottom, and we're more than happy to break it down and then make more video for you guys. So thank you for watching. Until next time, please give us a like and thumb up if you like us. If you don't, tell us why. We'd love to fix ourselves as well.